we discovered that what we had viewed as the problem, namely a person's morbid obesity, was typically their solution to problems that we knew nothing about.
Welcome, Dr. Felitti. Thank you for your time today, but also thank you for your contribution to medicine.
Well, you're more than welcome, Aimie. I'm delighted to be here.
Let's go back, because you were not expecting to find these results. You were not looking for these results. In fact, your study, your visual results came out of frustration that your best patients were dropping out of your program.
Yes.
Yes. Tell us about that.
Well, I started out doing infectious disease work for about 10 years, and then I was asked to start a department of preventive medicine. I had no particular interest in preventive medicine, but I saw it as a great opportunity because I'd have a lot of freedom and be running my own department. And it worked out well that way. The onset of the department was copied from an operation we had up in Oakland that really had attained worldwide attention, and that was called the Multiphasic Clinic up there. And they provided very comprehensive medical evaluation to adults. I went up to visit. I decided that we could easily copy that. I felt a need to add one component to it, namely psychological components to it. And so we built what we called here health appraisal, a 2-visit process that at its peak was providing very unusually comprehensive medical evaluation to 58,000 adults a year in one setting. This was really probably the largest single site operation of its type in the Western world.
Preventive medicine was a newer concept back then.
Oh, yeah.
It was still, at that time, still very much focused on what is our current problem, what is our current diagnosis, not necessarily how do we prevent people from getting these diagnoses.
Yes, correct.
So you were already a trailblazer.
Yeah, one of the frequent issues we ran into was obesity, and it quickly became obvious to me after I studied several hundred cases that sending somebody to see a dietitian was basically a waste of time. It got them out of the office, but when we looked what happened 6 and 18 months later, the results were really very discouraging. I mean, we treated a huge number of patients, 0 deaths, et cetera, 0 complications. And we were taking people down at maximum about 300 pounds in 1 year.
Which is amazing, impressive.
I mean, we were not seeing people who needed to lose 20 pounds, okay?
Right.
100, 200, 300. The heaviest patient we ever had was 850 pounds. So
I know that your patients had some insights, but in terms of just from the medical standpoint, that would have been a huge success for you as a physician. Yeah. And for the whole medical community. Like, look at what we're able to do. We are actually able to safely bring people down 100, 200 pounds in 1 year.
Yes.
It was like success. We've arrived.
And then we discovered we had a high dropout rate.
Yes.
The people who were doing successfully, which drove us nuts. And exploring that led to make a long story short, led to discovery that childhood sexual abuse was a frequent issue, totally unrecognized, in good part because we've all been taught as children very effectively that nice people don't talk about certain things and surely don't ask questions about them. So this was really quite an issue. And ultimately, we discovered that what we had viewed as the problem, namely a person's morbid obesity, was typically their solution to problems that we knew nothing about.
And they knew this. Yes.
The most important question in understanding obesity is how old were you when you first began putting on weight? And then the next question, that's a safe question. I mean, nobody gets upset with that. The next question, why do you think it was then? Why not 3 years earlier or 5 years later? Why then? What was going on? The ACE questions were related to the 10 most common issues we ran into in the obesity program. Number one was childhood sexual abuse. In the obesity program, in 1,100 consecutive adults, men and women, 55% acknowledged a history of childhood sexual abuse. And typically that was when weight gain began. But then others grew up in alcoholic households. Mom abandoned the family when I was 4. My brother committed suicide, all sorts of things like that. And it was clear that we were seeing people with monstrous backgrounds that were totally unrecognized. But how do you deal with these unspeakable issues? Well, that was easy. We would say to a patient in the exam room, I see on the questionnaire that, can you tell me how that's affected you later in your life? And we listened, period. No humbug about, oh, I'm so sorry. Oh, that must have been awful. That's terrible. No, we listened, period. But we did one other thing. We implicitly accepted them. And I used to be stopped several times every week for years by patients going home at the end of visit 2. Now, this is comprehensive medical evaluation now, not obesity. I mean, there were some obese patients there, but this was not the obesity program. By patients who wanted to thank me for asking those questions in the questionnaire, and then often went on to tell me how grateful they were to the examiner who, hearing the dark secrets of their life, was so nice to me. They even want to see me again. And I thought, my God, what must have happened to these people that they were living in such deep shame that being able to speak openly with someone, was of profound value to them. What happens to a child in the developmental years of their life, plays out a half a century later.
Things are happening on this cellular level that even though you don't see it on the surface, that does not mean that it has not changed one's biology. And that's what needs to be addressed. That's what we need to start looking at if we're really going to be able to help people and make some of these changes and even prevent them from getting the cancers and getting the autoimmune disease, because we can catch it early enough and we can redirect how the biology is playing out. Yeah. And let me just highlight for people, making sure that they heard what you said, because it was so powerful. One is just the asking, right? Like the asking is the doing. Yeah. There's you don't need to do therapy. You don't need to do all this counseling. Just asking is the doing.
Indeed, that asking and listening and implicitly accepting is a powerful form of doing. Mm-hmm. And the asking is best done initially by an inert mechanism. And then I see on the questionnaire that, can you tell me how that's affected you later in your life? And listening and implicitly accepting.